You know, I'm going to say this again because I think it's very important for everyone to know. The Republicans are on a mission to ban abortion in every nook and cranny of this country, despite the fact that a few of you, I'm not saying anyone in this room because I don't really know what you're saying, but there are a few Republicans who said, oh, the Supreme Court is now leaving it up to the states. But today we're not leaving it up to the states, are we? Uh, at first, let me make something clear. There's a little difference between banning abortion and taking someone's ability to pay for one away. I mean, you all are banning abortion for under-resourced women in this country. There's no question about that. That's starting with the Hyde Amendment, and then you got the next amendment, which called the Weldon Amendment, which threatens federal health care funding for low-income Americans, not just those who need abortions, by punishing states that try to protect reproductive health care access. And then, unbelievably, this bill, once again, guys, you're trying to prohibit funding for Planned Parenthood, which last year served over 2 million low-income patients, not for abortions, for health care, providing over 400,000 life-saving cancer screenings and providing over 2 million people with birth control, administering 5 million STD tests and treatments. This bill also prohibits funding for teaching hospitals where abortions or abortion referrals are provided. You know what this means? This means doctors are not going to be trained on abortion procedures, even when emergency procedures are needed. What is this going to mean? It's going to be more deaths and more morbidity. And now, see what else is in here. Banning fetal tissue research. That's a thinly veiled attack on abortion providers that serves to slow the progress on cures for diseases like Alzheimer's, cancers, Parkinson's, and more. And alarmingly, this bill prohibits funding for the implementation of any of President Biden's executive orders intended to increase access to reproductive health. I just want to make sure everybody knows exactly what this bill is doing. Because these are the kinds of things that our president is protecting, ensuring women can freely cross state lines to access needed care, clarifying contraceptive coverage under the Affordable Care Act, improving contraceptive access for veterans, ensuring data privacy for women seeking reproductive care. And then another policy rider would stop the Department of Health and Human Services from providing public information on abortion rights. You don't even want people to know their rights. You don't even want people to know their rights. And then there's that gag. The gag rule makes me want to gag. Does it make you want to gag? I mean, really, the rep, it makes you gag too, right? The gag rule would stop any doctor at a federally funded clinic from giving factual information to patients. That does cause a gag. And just, Ms. Lee, I want to thank you so much for your amendment because I want to just get back to the crux of this all. The crux of this all is that women, not politicians, should make the deeply personal decision of whether and when to start or grow a family. And so, again, I want to say it is a falsehood that Republicans are leaving abortions bans to the states. That is bad enough, but the Republicans in Congress are leading the charge. And let me tell you what this is going to eventually mean, folks. It's going to mean more women are going to die. It's going to mean that more doctors fearing criminal prosecution are going to be forced to deny care that is needed. That you're going to see the maternity care deserts are going to proliferate around this country. And drug safety is going to be based on politics, not science. And with that, I do support your amendment, Ms. Lee, and I yield back.